numbers. They can often be helpful in showing how we're doing in the fight against this deadly disease. But there's a famous quote. It's often attributed to Joseph Stalin. It goes like this: a single death is a tragedy. A million deaths is a statistic. Every American life lost to this virus is a tragedy. Every death is a story, one of our stories as Americans. So let's take a minute to listen to the story of a nurse in Oklahoma City who lost her husband to COVID-19 3 days after losing her mom.
I said, "Babe, are you okay?" And he was like, "I can't catch my breath." He's like, "I don't know, I just feel kind of funny." And he's never, ever sick. And then my mom's like, "I don't feel very good."
And that is when LIZANNE Jennings and her son Braden's nightmare began.
My father was dancing 2 days before he was sick. He was fine. My grandmother was fine. I saw COVID rip the life from their bodies.
An ICU nurse herself, LIZANNE separated her husband Dennis, her mom Linda, in different areas of the house and treated them like she would treat her own patients.
At 5 o'clock in the afternoon, he texted me that his oxygen was 95. My mom's texting the same temp. They're taking Tylenol and ibuprofen. And
Dennis's oxygen was at 95 that afternoon. But just a few hours later,
I put the pulse ox on. His oxygen was 72. He was hypoxic at that point, which means his brain was going without oxygen.
She decided to call 911, and he was rushed to the hospital. While Dennis was fighting for his life in the hospital, Mom Linda's condition started to deteriorate too. Linda asked her daughter,
"If it's okay with you, I just want to die here if I'm going to die." I said, "Mom, it's okay if you die in my house. I just can't help you anymore."
But the next morning, Linda's oxygen was around 78. The ambulance came to their home for the second time in a week.
She said, "LIZANNE, you've been the best daughter." She said, "Look at me, no regrets."
LIZANNE donned full PPE, signed a disclosure to visit her mom in the hospital to say goodbye.
I just wanted to hold her while she was dying, and I couldn't.
My mother's strength and courage let my grandmother go out with dignity and grace.
Linda passed away Friday, November 20th. 3 days later, LIZANNE's called to the hospital for Dennis. She shared these intimate photos with us of their final moments together.
"I'm here. I love you. You remember our talks, right? And he said, "Uh-huh." And I said, "I'm going to let you go now, okay?" And he said, "Uh-huh." And I said, you're going to be in peace."
He died a few minutes later.
I'm an ICU nurse and I help all these people, and I couldn't save my own family.
Abigail Ogle, KOCO 5 News.
Got to see those final moments. For more on the pandemic and its impact on healthcare workers, joining me now is primary care physician and ABC News contributor, Dr. Jay BHATT. Dr. BHATT, what's your reaction watching that story, an ICU nurse losing two of the people closest to her?
Thanks for having me. And frankly, it's heart-wrenching. It's a story that's one too many. We don't need to be here. I'm sad, I'm angry, I'm shocked, and I'm frustrated. So many are making sacrifices to keep themselves, their family, and others safe, including caregivers and healthcare workers like me and my colleagues. And then there's so many that are not, because they think that this is invincible or this virus is a hoax or whatever other line folks want to believe. The virus is real, and this story tells us it's real. It's taking away loved ones and family members. It's winning. And if you compete against it, you will lose. That's what I see on the front lines of caring for patients. So I had a patient break down in my arms because she was afraid of getting COVID another time and lost her sister to it recently. And we know how to win. We've kept positivity rates down in parts of the country at times during this pandemic. And it begins and ends with masking, distancing, staying home, don't gather indoors outside of your household and people you don't know. Hospitals around the country are at capacity, challenged to care for COVID patients and non-COVID patients in need. This was predictable, preventable, and it makes me so sad. We're here again, and it takes a toll on us.
Let's talk about those hospitalizations, because they have passed 100,000. What challenges are you and your colleagues facing when you're trying to care for patients at this point with the hospitals at capacity?
Well, they're dire. I mean, don't have the capacity to get them the care they need. People are out because they're sick. My colleagues are out, and so you have to have backup. People are working longer shifts than they should, and then they're at the risk of making mistakes because they're tired. We're human. Evidence shows us the lack of sleep affects doctors just like alcohol intoxication affects individuals. We have impairment in judgment and concentration. We do as much as we can, and that's not to also talk about the mental health toll. Every patient we lose or every patient that gets sicker is tougher on us. Families may be looking for presents this Christmas, but we as healthcare workers are looking for relief in ICU beds.
So the head of the CDC is now saying prepare for the worst months of this pandemic in the winter. So we're not even there yet. What concerns you most when you think about that?
I think it's absolutely right. I think the next 6 to 12 weeks are going to be very challenging with increased prevalence, with the holidays, with folks not doubling down on the public health measures we know work. And we know that when individuals go into homes, their family members or loved ones or friends, and they may be having comorbidities or over 65 or other significant health conditions, they're putting them at extreme risk. So shouldn't enter any indoor public spaces where anyone's unmasked, because then you're bringing that home or to your workplace or to others around you. We're in a very dangerous place because the baseline we're at now, the limited hospital capacity, and a further surge that will compromise care as well as overall capacity. I mean, I just had difficulty getting a patient yesterday who had abdominal pain for evaluation she critically needed in the emergency room. I had a difficulty getting a COVID patient deteriorating to a place that she needed care. And it takes a lot to get them there. And so every American needs to understand the clear risks of not doing the things we know work.
All right, Dr. Jay Bhatt, thank you.
Thanks so much for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.